Okay, everybody, welcome to the physical side of treating people with acid reflux, burping, belching, GERD, whatever you want to call it, problems with the upper digestive tract. Remember, this is treating people that have those symptoms rather than treating the symptoms. The goal is not to treat the disease, it's to make you healthier. So we have to really understand the physical aspects of these upper digestive symptoms, and the vast majority of people know the least about these. People have learned a lot about the chemistry and even some of the emotional, which is going to be in another video, but the physical people have no clue about, and it's so important. I find it's the piece of the puzzle that people are missing so often. So when I mention physical stresses that can affect upper digestive problems, where we actually have to first start is the jaw. Now, how the heck does a jaw affect my burping, belching, and reflux? Well, think of this. The jaw is one of the most important joints of the human body, because if your jaw isn't working properly, you can't eat and you die. That's plain and simple. Jaw doesn't work, you can't eat, you die. So the innate intelligence of our body, this wisdom that runs our body, understands this. And so if we're developing a jaw problem, usually from stress that causes us to clench our teeth at night or grind our teeth even worse, and if we're carrying tension in our jaw from there's an abnormal bite that you've dealt with a dentist, or there's an old injury, what the body does is it tweaks the muscles all around the neck area to try to keep the jaw on track as best it can. So it doesn't mean that you have no jaw problem if you don't feel it. It means that you may be carrying a lot of tension in your neck to compensate for an actual jaw problem. And so it's usually the muscles of the jaw that are out of balance. And some people notice that they're even tender to the touch. And it's one little fix there is you can start to rub them and just to feel if there's tenderness and tension there. So let's say that jaw affects the muscles in your neck. Well, what that causes then in the body are subluxations in your neck. Now, what is a subluxation? It's something that mainly chiropractic addresses. Really, only chiropractic should address. So chiropractors treat subluxations, which are misalignments that happen usually in the spine, but can happen in other joints, and they irritate the nervous system. So if you have a misalignment in the middle of your neck affecting one of the three middle bones, C3, C4, C5, the middle three bones in your neck, the nerves that exit out of those bones, in part, innervate or cause the nervous system to attach to your diaphragm muscle. Now, the diaphragm muscle is the thing I mentioned in the chemistry video that separates your esophagus. So I'm going to use this diagram again. Your esophagus from your stomach. There's a little sphincter that's a mechanical sphincter that we talked about in chemistry that also is aided by the diaphragm. So you can see it basically like this, and I'll try to get a little bit closer because it's not like the diaphragm's on the stomach. Maybe there's like a little gap, but as long as the stomach is below the esophagus, the stomach is always going to be below the esophagus. As long as the stomach is below the diaphragm and not herniating up through a hole in the diaphragm that we normally have, then we don't have a mechanical problem. But if that diaphragm muscle that's shaped like this with this little hole inside of it where the esophagus can pass through is weakened, your stomach can herniate through the diaphragm. That is called a hiatal hernia. And there's lots of different types of hiatal hernias. I just want you to get the basic concept that that stomach can rise up through the diaphragm. And if we have a subluxation in our neck, may be caused by direct neck problems or a jaw problem causing a neck problem, well, then that diaphragm can't function properly. And we can have upper digestive symptoms, mainly caused by a mechanical problem. Now, what else can cause a problem with the diaphragm and a problem with the stomach that's physical? Well, it's called an upper cross posture. So an upper cross posture is basically this. Now, isn't this the position that we find ourselves in all the time? hunched over computers or on our cell phones, looking forward, looking down. And when our shoulders are rounded forward and our chest is collapsed in, well, that creates a mechanical problem for our upper digestive tract. There's not much room in there, and we don't want to squash it up. So proper posture is so important in fixing people that have acid reflux. So what we want to concentrate on is improving our posture just mainly by thinking about it. Now, the best people that are going to target your posture are going to be, I believe, chiropractors. Of course, I'm going to say that because I actually am a chiropractor. Yet, some people can get better through methods called Feldenkrais or going to physical therapy, even acupuncturists, even your personal trainer may be able to help you with your posture. Just note that if you're too rounded forward and you're squashed and you have too much of a curve in that middle of your back, that could be a contributing factor, and you need to start to focus on standing upright. So what else could be a problem? If it's not even part of this chain, you can have direct trigger points or muscle spasms, fascial adhesions. You could have knots, let's just call them knots, along the diaphragm muscle. Now, the diaphragm you can feel right under the ribs. So if you go right into the midline of the chest and you'll feel a soft spot right there, that's going to be where your diaphragm is. And now the diaphragm is actually really deep inside. It goes straight through to your back, but there could be some knots here. And if you literally just feel around for those tight spots all along the ribs, you may feel a knot. And if you work on it, that can release pressure from the diaphragm. What I just have to let you know is that if you're not addressing these physical problems in your body, your reflux may persist. And just a side note, outside of reflux, that diaphragm also shares connective tissue. It's called fascia, this connective tissue, and some muscle attachment points with your hip flexors. So the hip flexors are right down here, and when you're sitting and you're folding up your hips, well, those can get tight, and the diaphragm and the hip flexors share connective tissue. So the mere act of sitting long periods of time can reflex and cause tension in the diaphragm, or it could be top down. Tension in the diaphragm can cause tightness in your hip flexors. Your hip flexors connect back to your spine, and I have actually seen this very often, that people with jaw problems and or neck problems have either tension along their diaphragm in their mid-back or lower back pain. Persistent low back pain not going away could actually be a diaphragm problem or a neck problem. I know it sounds crazy to some people, but everything is connected in our body. So what I want you to do is look for a professional that can help you with these things. If you want to start on your own, just concentrate on your posture, releasing tension from your diaphragm, but make sure you get corrected in your posture by either a professional physical therapist, or my best recommendation is a chiropractor. So I hope these mechanical, physical stresses that affect people with reflux, you have a better understanding about, and you're going to take some action soon. Hope that helps.